Let's continue on this matter and take a look at the Gauteng Health Department, which says 194 babies were born in the province on Christmas Day. Now, this is the highest number ever recorded. Gauteng Health MEC Nomantu Nkomo-Ralehoko joins us for more. MEC, a very good evening to you. Thank you so much for your time. Before we get into the depth of underage mothers and teenage pregnancies, in the first 12 hours of Christmas Day, 103 boys and 91 girls were born in Gauteng, including a set of twins. I mean, bundles of joy. How did the hospitals and community healthcare centers cope?
They were coping because we had to capacitate our staff, because they were aware that on Christmas Day we will be waiting for these babies to come. So they didn't have a problem with that. A number of them were at work.
What stands out, of course, is the number of teenagers giving birth. It's an issue that's quickly growing into a major concern. How are you approaching this as a government?
It is a major concern indeed, because even yesterday, similar to what Limpopo MEC was saying to you, we have a 15-year-old that gave birth on the day of Christmas. And it's a worst situation that all of us, we don't want to do. But as the department, we have established youth zones within our facilities. And these are safe spaces that are dedicated for youth to address all health issues that are affecting them, including teenage pregnancy. So I think we will continue with those sessions that we are doing. And we also have, again, through our clinics, we're encouraging access to family planning services in our facilities that are free of charge. And when we go out to communities, again, every week, as you always follow us, we make sure that there are desks that are just focusing on youth, and we're telling them the do's and don'ts at their age. So it's really painful to see a 15-year-old giving birth. And as mothers, we need to make sure that we protect these children, because it's not that just a sexual activity that they're involved in. They are not supposed to be involved in sexual activities at that time. Once you see that, you can see, you know that it's either it's an issue of that child that has been raped, or there's something that has happened in the family. So those are the issues through these youth zones, then, that we do follow-ups to the parents. Even this child that has given birth to a 15-year-old that gave birth yesterday, we are arranging that the district must make sure that they have a session with the family so that we are there and assist the government.
Any indication on how old the youngest mother was here in Gauteng?
It was 15 years old. I was in tears when I went to her and see her, this little thing holding a baby. Because even my daughter is not 15 years, it's 18 years old, and she doesn't have a child. And you see that one with a child holding a child at the age of 15. Definitely that child was pregnant when she was 14 years old. As you can see, that it's a young thing.
So these alarming numbers on adolescent pregnancies reflect, of course, among other contributing factors, the secrecy around the sexual assault that young people are exposed to, what you were touching on. And you also spoke about supplementing the measures you have in place. I mean, you talk about youth zones, you talk about family planning sessions, and of course a lot of the talk of how your work needs to now extend to comprehensive sex education programs in school, that the two cannot be isolated. How are you working with the Department of Education to ensure that the work around these youth zones that you speak of is now expanded and extended into the classroom?
You are right. We're working with the Department of Education, which is our sister department, including the social development. We are rolling out an integrated school program that is the three departments work together to ensure that some of these things, we talk about them especially in January. We'll be visiting schools again, but the officials will continue that program even for the whole of the year, not only in January as we'll be doing. But we are going to start it again during the Back to School program, which is a campaign that we are doing of accelerating the interventions that we must be doing as parents, as mothers, and as teachers in our schools. So that's the program now that we're going to prioritize, so that we're able to eliminate this rate of young girls that are getting pregnant.
With these youth zones, how do they work, MEC? Because we know that the government has implemented other strategies like making contraceptives available to girls as young as 12, but these are proving to be inadequate.
You are right. That's why we felt that if we have youth zones that are having young people that are talking to them, because we bring young girls that are talking to other girls, showing them the do's and don'ts as the young girls, but indicating even the contraceptives that they must use so that they must not engage in any unsafe sex. Because that's another thing that we need to talk about, difficult as it is, that subject to some of us, but we are instilling that now so that we're talking about it. And we're using these groups in the youth zones that must be the ones that are spearheading that process, leading in that program, that we must talk to these young girls, working very closely then with the department and the Department of Education.
What about the secrecy around sexual assault that young people are exposed to? I mean, we saw and heard a lot about it during the COVID-19 period with an increase in rape incidents amongst young people. How are you tackling that?
It's part of the things that the youth zones are discussing, because sometimes they keep quiet. Because, for example, there was a little girl last week that I met at Dr. George Mukari, 14-year-old. And when she was telling me that, because she wanted to kill herself, and I had a session with her, she was telling me that she wanted to kill herself because the gentleman that is their driver in their combi is the one that has been sleeping with this child. The first day that he did this, he called her and he told her that she looked at the eyes and tried to bring her closer and then kissed her. So you can see that because she's young, she allowed this man to do that. But the other thing is that this man continued then raping her now, immediately after that kiss, because she had to do other things that bring this girl closer to her, assisting her with money, like this girl was telling me. So, but the guy is a driver. So he's the uncle that is taking this child to school every day. So, which means it's not the only girl, definitely, that this guy is doing this to her. So those are the other educational programs that we must do, so that when a man or an uncle that is calling you, or a driver of your bus, don't keep quiet when he does that. Even if it's that first kiss at the cheek or at the forehead, you must know that it's another thing that is going to follow. He will want to sleep with you. Talk to a person that is close to you, or inform your mother, because I was asking her why she didn't tell the mother. And she said she was scared of telling the mother. And I said to her, in future, don't be scared of telling your mom anything that happened. Because my fear was that I'm sure even this child, she's going to be pregnant, because this man was not even using this protect, so he was not doing safe sex with her. So was sleeping with her without condoms. So you can see those are the things that these children go through. And they trust these people, because for me, I saw the child that he trusted this man because the man is carrying her on daily basis to school, not knowing that he has other things that he wants to do to her. And this is what we should be doing now in our communities. Hence, I'm saying we need to strengthen our collaboration with other departments. We must work very closely together so that we're able to deal with these problems. And we must deal with the perpetrators again, because if it's a man that is being known, the man must be taken into task. We must make sure that that man is going to jail, because he doesn't need to stay amongst our children. He's a dangerous man amongst the society. And that's why our children are experiencing in this country. Yeah. And it's a painful thing, I have to be honest with you, because imagine if that man is sick. That child is going to be sick. But again, that man has robbed that child their life now, the teenage life. He's no longer a teenager now. He's a young adult done by this man.
It also speaks and leans quite closely to the education department that you will be working with around this matter when it comes to the vetting process, which is needed very much so when appointing teachers, teachers who look after the children, and are now, we're seeing an increase of many of them being accused of sexually assaulting children. Now, MEC, in many societies, there's the challenge around an imbalance of power that's gendered and could manifest in different ways in relationships embedded in our societal institutions of socialization like culture and tradition. For example, it teaches young girls and women that to be culturally obedient, shy away from using modern contraceptives, and effectively doesn't encourage exposure to sexual education and rights, while it teaches boys and men the opposite. How do you think you could be part of the solution to this bigger societal problem?
As government, we must make sure that our programs now, when we talk to communities in our programs, we involve these sensitive issues, because sometimes, as you are indicating, the issues of culture, it becomes difficult to talk about them, but we must talk about them. We must tell our children that these are the things that even themselves, they must talk about them, and they must be aware that there are these men who are dangerous amongst our society. They must run away when they are being called by them, or they are touching them in a manner that is not right, because you can see a person that touches you in a manner that is not right. And because there is an increase even in the province in terms of these teenage pregnant mothers, these young mothers, there's an increase of these young mothers, and it's something that we should have stopped as communities. And I think we must work again with the NGOs in our communities, because NGOs are there to assist us to beef up the work that government is doing, because government can't do that work alone. It's the work that we must all do together, then bring in the departments, then, because departments have resources that they can use on a daily basis to protect our children, and make sure that anybody that found doing these wrong things to our kids, that person is taken into task, but with a group of people, not only one individual or a parent that is facing this situation because of a daughter has been involved in this bad thing that is happening in our communities. I don't even know how to describe this, the way that is it's so traumatic to me. It's very difficult even to describe the environment that our children now are growing up in.
Yeah, there's also a lot of talk, MEC, as we talk about, the young people giving birth. There's also the question around the number of arrests, because, it's your department, it's the education department and the police. How are you encouraging the young people, or perhaps looking at ensuring that those who may be responsible are brought to book? As you receive the young patient who gives birth, how are you encouraging some sort of conversation to get a sense of what is going to happen going forward, and what has possibly happened to result in the young person giving birth?
We are involving social workers again. Hence, I said we are working very closely with the Department of Social Development, because social workers must be there, because that environment already that I've picked up, it needs social workers, because we need to assist that child. Because even yesterday when she was holding the baby, you can see that this thing is young. She can't even hold properly this child. So there must be lessons that are done by us to indicate that this is the young thing, this is the young child, how to breastfeed to this young child, because we're encouraging them even to breastfeed these kids. So those are the things those are the sessions that we must do ourselves as mothers and as parents, as public representatives in our constituencies. We will definitely even report when we come back now in January, going to that program that I indicated to you, that we call it Back to School program that we do as government. We will make sure that there are some notes that are part of the notes that we'll be communicating with the children. When we're addressing them at school as learners, we will address them even in those areas that we know it's difficult to talk about them, but they need to know, because it's something that at the end, it's destroying our society.
Very well. Thank you so much for your time. Gauteng Health MEC Nomantu Nkomo-Ralehoko speaking there about the number of births on Christmas Day, the Christmas Day babies, as well as the other conversation within the conversation when it comes to underage mothers. What is going to happen and what is the way forward?